Hello and welcome. My name is Dallas Wallace, and I'm a certified orthopedist who works for Dr. Zen Footwear. I'm the head R&D engineer at Dr. Zen Footwear, as well as being their chief orthopedist. It's my job to introduce you into the wonderful world of fitting diabetics in their homes. Of course, this is a necessity. If you've learned anything about diabetes in recent months, you know that people are suffering from a variety of complications to do with their diabetic conditions, not the least of which are situations with their feet. Although they're informed when they first are diagnosed with diabetes as to the risks they may encounter as life goes on, one of the things they choose to ignore are decisions about their feet and their foot care. My particular pedorthic practice was in the diabetic arena, and so I'm bringing to you some real-world knowledge as to how you might want to deal with those issues as you deal with patients in your burgeoning practice. Of course, the main issue we deal with footwear is diabetic neuropathy. And what this means to the diabetic patient is that over a period of time, they may lose sensation in their feet, including loss of motor nerves, and so their motor skills with their feet, or in other words, their musculature, doesn't work as it once did, which tends to affect balance. In addition, proprioception, or where the foot is in space without looking at it, tends to become impaired. And also, a sense of loss of pain sensation affects the patient. This means that they may well injure their foot and not even realize that they've done this. And this can lead to traumatic amputation, unfortunately. The first issue we'll be dealing with today will be setting up appointments. I would like to remind everyone to please use patience, courtesy, and understanding when dealing with senior citizens. They may be receiving an influx of sales calls at their homes pretty regularly, so to have a call of this nature come in may be somewhat confusing for them. Begin by opening a rapport with that person, as in the future you may see that person several more times. Hello, my name is Dallas Wallace, and I'm the certified pedorthist that will be delivering your diabetic shoes for you. I wonder, have you seen one of our catalogs? I see. Okay, well, I have one right here in front of me. I'd like to ask you a few questions if I could to help me with the process. Are you an active person? Do you need assistance to stand and walk? Okay, are you a person that dresses casually most often? So are you a person that primarily wears a dressy form of shoe? Do you go to church quite a bit? I see. So you're within your home primarily? Uh-huh. All right. And of course you're a lady. And what size would you be? What was the last size shoe? And if you're not sure, you can check a shoe that you have in the house. If you just pick it up, normally it says right inside the tongue what size shoe you actually have. I see. Okay. Do you suffer from any other situations I should know about? Do you have edema? In other words, swelling around the ankle? And does it happen frequently? Okay. And which part of your foot swells? Is it the area completely around the foot or only in the front? Okay. Would you say that you're a person that would wear a neutral color shoe or maybe a brown? Okay, so black is a little more formal and more what you're looking for. I see. Okay. And in your opinion, do you have a wide foot? All right. Do you deal with arthritis at all? Because many of our shoes do come with Velcro closures as well as a lace closure. Okay. Is there anything else that I should know about in fitting these shoes for you? Ah. I see. All right, well, this gets me my preliminary information. I will be in touch with you shortly to let you know just when I'll be visiting you. And thank you very much, and have a good night. And so, at this point, we have made our appointment with our patient, and we have shown up on time. We've asked our patient to find a straight back chair, which is approximately 90 degrees. Or in other words, when we look at the side of it, his leg here, we see a nice 90-degree angle. It's a firm chair. It has no wheels on it. And we are seated somewhere where we can plug our heat gun in and be relatively sure it's not going to burn the floor. So I have, in addition, asked Mr. Stevens to remove his shoes and his socks so that we could observe his feet. And in some places, it's required to wear latex gloves as we perform this procedure. And so that's what I'll do for the sake of argument. Now, to begin with, I've got Mr. Stevens here ready for our appointment. I'll begin with my paperwork. At this point, I usually say something fairly jovial about the fact that this is the hardest part of the whole procedure. So to begin with, before I can begin with my patient, I have to have his agreement that I will observe his privacies in the form of this privacy practices form, which I will then sign and I will have my patient sign. I'll leave a copy with him and I will take a copy with myself. I will leave with him one of these HIPAA forms, which just describes all of our responsibilities in protecting his privacy. So we'll leave that with him. And I'll begin my actual evaluation. So just going down the line with my foot evaluation form, I begin with the gentleman's name, which I write in, and then I begin with a series of questions. Sir, have you had any amputations that I need to know about? And of course we know this because we're observing his foot, but just in case, we've asked him the question. Have you had any ulcerations to speak of?
No.
Okay, now an ulceration, of course, would be an open wound on your foot at any point.
No.
No. Anything on your legs that I need to know of?
No.
All right. And let's take a look. Is your foot sensitive at all, sir?
No.
Okay. So now we'll pick his foot up, supporting his whole weight. You can relax. We'll take a look at his foot, beginning by looking all around the outside of the foot. Around the heel, the bottom of the foot, and now between the toes. What we're looking for, any cracks, any dry skin, any areas where there might be a wound or an open sore. We observe the nails to see that they're cut appropriately and that there's no fungus to speak of. And now we'll look at skin tone. And now, just to check circulation, we'll give the skin a little pinch and observe how quickly it takes color to return to that particular area. Very, very rapidly in this case. His foot looks very healthy. Mm-hmm. Do you suffer from any swelling in your ankles that I need to know of?
No.
No. Any unusual pain in your feet that I need to know about?
No.
Okay. All right. So let's take a look at his overall foot strength. I'm going to pick his foot up from the back, and I'm going to ask him to pick his foot up towards him. I'm just going to offer a slight bit of resistance. Okay, and he's doing very well with that. And then back down again. Okay. Then push to the inside. All right. And push to the outside. Very, very good. Okay. And how far down can you curl your toes? And now how far up? Very good. Can you draw your whole entire foot towards you? Yes. And relax. Let's see the same thing again on this side as well. And now as I continue down my list, I've observed whether or not he has any current callousing I need to be concerned with, and I've made my appropriate notation about that. If I do notice anything unusual, I would then ask the patient, are you due to see your doctor anytime soon, sir?
Within a month.
I see. I would recommend that you mention that to him, just to have him take a look at it and see what he thinks of it. If it's something in the form of broken skin of any sort, I'm going to stop my visit at this point and recommend that he see a doctor immediately. This is not my area to deal with. Anything beyond simply fitting shoes and dealing with a healthy foot is not something that I'm looking to do. And now I'd like to ask you, sir, do you suffer from any neuropathy to speak of? Any burning, tingling, or numbness in your feet?
No.
Okay. All right. And I'm observing his foot. I'm looking for deformities of any type. Are his toes curled, clawed, mallet, any of those things? Do we notice that his big toe wanders away from center line? For instance, does this toe move to the outside? And in his feet, very, very healthy foot I see here. No bunions to speak of. So I'll make note of all this. Okay. Doesn't look like he has a loss of fatty tissue. Do you experience any discomfort if you walk barefoot in your home?
No, not really.
I see. And of course, it's not recommended for diabetics to walk barefoot in their homes anyway. Okay. We've talked about swelling, so I've moved down to that. So overall, in my notes column, I'm going to say extremely good foot health for this gentleman. And moving into the bottom, I'm looking at his foot flexibility, which we found was very, very good. He's not rigid at all. He doesn't seem to be fused anywhere. I'm looking at his arch structure at this point. So if his foot is in a 90-degree position and we're observing his arch structure, we can see that he's got almost 2 inches worth of arch, which is a very healthy arch structure. So I would call that somewhat high. We've talked about his bone structure, which is moderate. And I've observed the gentleman as he's walked into to the room and seated himself in the chair, so I know that his gait is stable. I will once again ask him if he needs any assistance when he ambulates. Do you use a walker or a cane?
No.
I see. Okay, that's good. Of course, we know his nails are extremely clear, very well trimmed, so this man must be in the care of a podiatrist. So, are you seeing your podiatrist pretty regularly?
Yes.
Good. All right, and now we'll take a measurement for this gentleman. So I'll begin with my Dr. Zen stick. Now we'll check the length measurement for his foot, which we'll do in a seated position. So if I were to go exactly, it'd be about 9.5 to 10. We'll pull his foot out. Now that we have this measurement, we'll readjust for our width measurement. We want the widest point from knuckle to knuckle, even if it's on an angle. We'll remove the foot. I would recommend that you actually size a person in a seated position and then double check it when you fit the shoe. Not everyone is as stable as they could be standing and placing their weight on top of a stick like this. We predetermined which shoe is going to be most appropriate for our patient, so I'm going to move right into this part of it. When I fit the actual shoe on the patient's foot, I begin by using the inlay that comes within the shoe. So I'm not going to work with my inserts just yet. This gives me an excellent opportunity as well to put one of our wonderful Dr. Zen Diabetic socks on this gentleman, get him a chance to feel what that feels like. As a personal marketing tool, I tend to leave a person with a pair of these socks and then inform them as to how they can get in touch with me if they would like any more. What is important about these socks, as well as these shoes and inserts, is that they provide a frictionless surface for the foot as it motivates. Or in other words, everyone's foot, as they move around, tends to have different points which have more pressure than others. Maybe they protrude a little more, perhaps it's the manner in which the person walks, a deformity, etc., etc. So I do want to make sure the socks are on all the way. A frictionless sock, such as this, is considered medically frictionless, as well as a plastizote surface, such as this, and a shoe that's considered to be wide enough and is considered to be medically frictionless inside is exactly the situation we need on this person's foot. So in order to keep your feet from ulcerations in the future, we're trying to provide you with a situation where your foot has no shear dimension, or in other words, friction as you move about. We do that with this frictionless sock and then with this plastizote material, and we finish it with a shoe that keeps the foot extremely stable so that accidents are fewer to occur, even if the person is maybe not as steady on their feet as they could be. So now that we've done this, we'll take a look at the shoe actually on their foot. Pull out another handy tool. Always bring a shoe horn. Foot goes right in. I always advise my patients to push their foot all the way to the back of the shoe. There we go. So they're held firmly by that counter. The back part of the shoe, or the stiff part around the heel, is called the counter. If you would, sir. Thank you. And after we put these shoes on your feet, we're going to have you walk for just a bit, and then we're going to observe your feet inside your shoes once again. And now that we've determined that this is indeed the appropriate size for him, we'll take these back off, leaving the socks on this time, so he has a protective surface on his foot. I will remove the inlay, however. Place that in the box. I always leave a hand on the person's foot to help them in placing their foot back on the ground again. Not everyone is as strong as they once were. So these are the appropriate inserts for his foot. All we need to do at this point is heat form them. So, beginning with this, we will heat form this. I'm going to reach around with my hand, and I'm going to get all 4 fingers in this man's arch from one end of it to the other end. I'm going to hold it completely up against the patient's foot. As you can see, I'm holding it with my thumb. I'm just going to wait for it to cool. If you count this out, it's somewhere between 10 and 15 seconds. Another good way to tell is if you slowly remove your fingers and the arch stays in place without retracting, you know you have the arch. So if you'd move your foot, please, sir. Take this off. Remove the old inlay. Place our newly formed insert inside. Now that we have this pair completed, we would replicate this process with 2 more sets of orthotics. This is the point where I explain to the patient that while these are wonderful at maintaining a person's particular foot health, they also have a lifespan, and that lifespan is approximately 4 months. So I would suggest that you mark your calendar 4 months from today, and then again 4 months from today, until you've completed an entire year. So about every 4 months, you take the old ones out and you put a new set in, and that makes up an entire year. At this point, I usually share with my patient that the nature of the therapeutic shoe bill is that a person gets a new set of shoes and inserts at the end of each calendar year. And so that means January 1st, you are again entitled to a new pair of shoes. Again, the process here is that you have several pairs of shoes in your closet to choose from, so that you are always in a pair of diabetic shoes. Occasionally, of course, you might find yourself in a situation where you don't quite have the appropriate size insert for the person's shoe. For instance, you have a size 11 while the actual shoe you're putting on the person's foot is a size 10. At that point, it's quite acceptable to take the inlay from the shoe, place it down over the actual insert using any sort of pen, making a mark around the edge of it, and then trimming it with, of course, your very fine scissors. Everyone should have a pair of these in doing this. Okay. Now that we've done this and we've prepared all 3 sets of inserts, I'll place them inside of his box for him, as well as the old inlays. And I will place the shoes on his feet one more time, this time completed. So this is a whole unit. You should notice some additional comfort here, sir. I'm going to double check my width measurement at this point, because this inlay that I've just put in here is a little bit thicker than the previous one. This Plastizote insert has a little more thickness to it. Right. Thank you so much, sir. Very cooperative patient. Again, each time I put my foot and my hand against the back of the person's foot and pull the shoe forward to make sure that their heel is entirely seated in that counter. Each time I ask a patient to rise out of their chair, I remove all of the obstacles out of their way. And of course, sometimes we find ourselves in a different circumstance. We find that the physician has required us to use a K0629 insert rather than the standard K0628. For this, we need to cast. And so I have my handy impression box with me. This